second episode of The Voice of the Thyroid. Today we dive into a technology that is reshaping the way thyroid nodules are treated. This technology is EchoLaser. How does this microinvasive laser treatment work and which are the conditions can benefit from it? We discuss about it with Professor Marcin Barczyński, Head of the Department of Endocrine Surgery and full professor of surgery at the Jagiellonian University Medical College in Kraków, Poland, who served as president of European Society of Endocrine Surgeons between 2022-2024 and is currently the president of the Endocrine Society. So, thank you, Professor, to be here with us.
And good afternoon, my pleasure.
And can you explain how does EchoLaser work?
Yes, absolutely. EchoLaser is a microinvasive ultrasound-guided treatment which is designed mostly for benign thyroid nodules. It uses laser-induced heat to destroy portions of nodular tissue, leading to a progressive reduction in nodule volume and disappearance of compressive and aesthetic symptoms in the neck over time. So how it works in general, it is an ultrasound-guided procedure, so we use extremely fine needles, less than 1 millimeter in diameter, which are inserted under ultrasound guidance into the nodule, and through the needle we insert optical fiber. This is a laser-induced cytoreduction technique. So we actually use laser energy which hits the tissue, destroying the targeted area. And over time, the body naturally reduces the necrotic tissue, shrinking the nodule maybe 50, maybe 60% within a year, sometimes even more than that. So it is a very nice alternative to surgery. No surgery is required in these patients. It avoids any incision, stitches, and long recovery times. It is usually outpatient procedure, so patient is discharged the same day home. So it is quite quick and painless. The procedure takes up to 30 minutes, requires no general anesthesia. It is usually done under local anesthesia or no anesthesia at all, and allows for immediate return to daily activity. So in general, ModìLite is particularly beneficial for patients who prefer non-surgical options or cannot undergo surgery due to medical conditions. It's also used for malignant neck lesions such as microcarcinoma, papillary thyroid microcarcinoma, some metastatic lymph nodes, where it provides complete ablation of the affected tissue.
Okay, amazing. So with this laser, we can treat different typology of pathologies for the neck, correct?
Absolutely, yes. So there are different conditions potentially to be treated with this technology. So big number are benign thyroid nodules. Large nodules causing aesthetic concerns or compressive symptoms to the trachea are a very good indication for that technique. Also, we may treat some patients with small papillary microcarcinoma, usually not larger than 10 millimeters. Some say that even 13 millimeters could be candidates. It's obviously depending, and proper patient selection is necessary to have good outcomes in that. In addition, huge experience in this technology, obviously, to be safe. We can treat also some metastatic lymph nodes. It can be a technique which is sort of the alternative to redo surgery in the neck. For some patients, it's contraindicated. And also, patients have different comorbidities and are not good candidates for surgery. And obviously, it's an excellent technique for them when there are too many contraindications for surgical treatment. We can go for this minimally invasive treatment.
Okay, amazing. So regarding the benefits that this typology of treatments can give to the patient, you mainly already explained it to us, but if you have to choose the four most important benefits that EchoLaser can bring to the patient, which of these benefits can be?
Yeah. EchoLaser offers several advantages over traditional thyroid treatments, particularly surgery, but also other thermal ablation techniques. So the key benefits when compared to other techniques are it is really minimally invasive. So it uses extremely fine needles, less than 1 millimeter. The procedure requires no general anesthesia, so it is done under local anesthesia or no anesthesia at all. So it reduces risk and also recovery time. It is quite a quick procedure, takes no longer than 30 minutes on average, and allow patients to return to daily activity immediately the next day. Pain is usually minimal, recovery time is short. It is very effective in volume reduction of the tumors. So it usually leads to at least 50% reduction in nodule size within a half a year to 1 year after treatment. And obviously patients can expect improvement in compressive symptoms and also their aesthetic concerns as well. What is extremely important, it provides thyroid function. So if patient is euthyroid before the procedure, usually these patients also remain euthyroid. So no thyroid supplementation therapy is needed after that. It is safe also for high-risk patients who have contraindications for surgery because different comorbidities. And it is a very precise treatment, controlled treatment, done under ultrasound guidance for accurate targeting and ensuring effective ablations of nodules and also malignant lesions. So it is very, very precise technique, which is not always the case for other ablation, thermal ablation techniques.
Okay, just last question. Do you think that the presence of EchoLaser smart interface, that is the interface that comes with the EchoLaser laser, is important and give more safety to the treatment itself?
Yes, this interface provides opportunity to plan the treatment. So ultrasound guided how to introduce the needle precisely into the middle of the thyroid tumor. For small lesions, it's even more important because patient is awake, can swallow, breathe, move, choke, and so on. So using this guidance, obviously, and planning of treatment, we can do it very, very precisely under ultrasound guidance, which is very important for the safety of the procedure.
Okay, thank you very much for your time, and thank you for explaining us how EchoLaser is working.
Thank you. It was my pleasure.